I'm Dr. Luke. I'm a gastroenterologist from Gastrointestinal Health and run a general practitioner podcast called Everyday Medicine. And I've also received a stack of questions from patients who would like some of their digestive problems answered. So today we're going to try and discuss some of these and unravel some of the problems that our general population have in relation to digestive disorders. I had early on in your medical training, you look at whether you're going to become a general practitioner. I guess there are lots of different fields. It's simplified it, but it was for me. It was going to be my dad and my mother were both general practitioners, and I didn't really want to do that work. That wasn't something that I wanted to aspire to. I wanted to do something a bit different to that, and I was thinking about surgery versus being a physician, and I think the surgical lifestyle didn't really appeal to me. Also, physicians seemed to me to be a little happier. I thought they were just happier. I remember being in the operating theatre and the surgeons were just a little bit tense. That didn't entirely suit me. But I went down the physician side. Now, why gastroenterology? I was interested in cardiology, but I was training really just before these very substantial breakthroughs in cardiology came. There weren't a lot of people in Australia doing ultrasonography. There weren't people doing coronary artery stenting. There weren't people doing electrophysiological studies and ablating arrhythmias. And all that came just after my training or my opportunity, if you like. So I was really not so interested in just dealing with chest pain or someone's got an arrhythmia middle of the night. I'm going to have to go and sort that problem out. And I was drawn to gastroenterology because it had the component which was talking with patients, that sort of clinical interface, and getting to know your patients, which is a very big part of why I wanted to be a doctor, understanding their clinical problems and hopefully being able to provide some effective treatment strategy for them, which would improve their lifestyle. But it was also combined with this wonderful ability to perform procedures on that patient, generally pretty safe procedures. Most surgical procedures, as conducted by most surgeons, are much higher risk than endoscopic procedures, which allow us to evaluate the digestive tract and to do some cool things like remove bowel polyps or to evaluate carefully how your management is going for someone who's got Crohn's disease or colitis, or look for this bacterium Helicobacter, or understand why the reflux is so bad. What's the anatomy like, so we can really participate in the management from that degree of understanding. So there was also the component of research that came with gastroenterology, and I haven't gone down that pathway, but I felt it had all these different sorts of spokes. I could talk to the patient, be involved with acute and chronic care. I could do research if I chose to. I could be involved with this sort of cutting-edge sort of investigative procedures. And one of the things that I do is ERCP, which is a procedure that allows us to look at the biliary tree, remove stones from the bile duct tree, and that's really very satisfying. Someone who comes in and they've got an obstruction in the bile duct from a stone, or maybe a cancer in the deep yellow, or they might have an infection that's overwhelming, a septic event, and you can go in there and clear that ductal system, remove the stone, or put some plumbing in, which allows that system to drain, and there's an immediate result. It's sort of incredibly satisfying to do that, and patients really appreciate that level of care and attention. So that's what drew me into it.